2, 1. Hello, everyone, and thank you so much for joining us for our Connect with Network Health virtual event. I'm Kelly Vander Wielen, the Community Engagement Coordinator here at Network Health, and I will be your host for today. We are looking forward to spending this time with you and appreciate you joining us for this event today. I'd like to give a big warm welcome to our Network Health members, to my Network Health colleagues who are here with us, and also those of you joining us near and far. Our Connect with Network Health events give us a wonderful opportunity to live our mission here at Network Health, which is to create healthy and strong Wisconsin communities. So here is what you can expect during our time together today. First, I'll talk a little bit about our Network Health mission. Next, I will introduce you to Chrissy Bowe, our Senior Wellness Coordinator here at Network Health, who will be sharing information alongside Christy Fast, who is also a member of our Network Health team, on the benefits of whole foods and a plant-based eating. So Christy will talk to you about ways to transition this kind of healthy eating if it's something that you're interested in, and Christy will also be sharing her personal journey with this type of eating. So it's pretty interesting. There's so much to learn. Just really happy that Christy and Christy could be here with us today. So next up, so I just want to talk a little bit about Network Health because today's event gives us the opportunity to connect with you and also support one another along our health and wellness journeys. Whether in a virtual room like we are today or at an in-person event, our connection with our community is really important. For nearly 4 decades, Network Health has established strong roots in our local Wisconsin communities by putting our members first. We are co-owned by 2 high-quality health systems, Froedtert Health and also Ascension, Wisconsin. At Network Health, we take the extra steps to make health insurance affordable and understandable so our members can make the most of their coverage. Network Health improves the lives of local business owners, individuals, and also families as we pursue our mission to create healthy and strong Wisconsin communities. Our employees, some of whom you'll meet today, demonstrate their dedication and passion to helping others also improve their life, health, and wellness by getting involved with organizations that serve our community. We put in the extra effort because we want to and not because we have to. We know that you are our family, friends, and also neighbors. So we're side by side with you and our communities. Just want to thank you again for joining us today and for choosing to spend time with us here at Network Health. All right, so I'm really excited to first introduce you to Chrissy Bowe, our Senior Wellness Coordinator here at Network Health. Hi, Chrissy.
Hi, Kelly. Thanks for having me.
Yes, thanks for being here. I'm going to turn things over to you.
All right, sounds good. So today we're going to be talking about plant-based eating and whole foods and what exactly that means and what it looks like. So if you want to go to the next slide, Kelly, we'll be talking about is this the right diet or is it even a diet? There's so many different diets out there. There's keto, paleo, South Beach, Mediterranean, low fat, intermittent fasting. So is whole foods, plant-based eating, is that just another trend? And most dietitians, although I am not one, I've worked with many, most dietitians will agree that a trendy kind of fad diet is something where you're eliminating a whole food group, and that would be a red flag. So sometimes when I'm talking about whole foods or plant-based eating, it comes up like, well, aren't you eliminating a whole food group in that things coming from animal products are being eliminated? That isn't necessarily make it a fad diet because you can still get those vitamins and nutrients and all of those benefits from other things. Whereas you're not removing all fruit, for example. So when we're kind of looking at this whole foods, plant-based eating, it may be helpful to not think of it like a diet, but a lifestyle, because that is something that you can do in the long term. And maybe just changing your terminology from a plant-based diet to a plant predominant way of eating might be more suitable for you, and not feeling like you have to subscribe to something 100% of the time and then you're on the wagon, off the wagon. So if it helps you to think of plant predominant, feel free to use that terminology instead. So next we are going to look at what exactly whole foods, plant-based eating or plant predominant eating is. It means that you're consuming mostly whole foods in their unprocessed form. So you can go to the next slide, Kelly. You're eating foods such as fruits, vegetables, beans, legumes, nuts, seeds, whole grains, and small amounts of healthy fats. It would not include, or it would limit things like meat, poultry, fish, eggs. It would also try to limit or eliminate as many processed foods as possible. Things like chips or cookies would not be included. And it's important to point out here that somebody could technically be a vegetarian and eating that way by not consuming animal products, but still be consuming a high amount of unhealthy, mostly processed, refined foods. So you taking Oreos, for example, if you look at the ingredients list, that is a good example. It's technically not animal products, but it wouldn't be healthy either. So just something to kind of keep in mind as you're doing your grocery shopping and filling up your pantry. So the focus here, again, is on whole foods, that perimeter of the grocery store, and trying to eat things in their whole form. So if it didn't come from the ground or it didn't come from a tree and you can't pronounce it, it probably wouldn't be included in this type of lifestyle. So next we are going to look at how many servings of fruits and vegetables we should be eating. So what is recommended, the number of servings of fruits and vegetables per day, the number we should be eating per day is about 5 to 9 or more servings. So as a health coach, I work with our members, and when I tell them that can be really eye-opening. If you're eating 1 or 2 servings of vegetables currently and trying to bump that up to 9 servings, that can be really overwhelming. And then as we look at how many people actually get that amount, if any guesses, it's a small percentage actually. Only about 10% of our population is in fact getting that 5 to 9 servings per day. So by focusing on a plant predominant diet, you're going to push yourself to be getting those 5 to 9 servings every single day. So next we're gonna watch this short video, which does a really great job from a doctor explaining why fruits and vegetables are good for our health and coming from a cardiologist point of view. So I hope you enjoy this short video.
Over 600,000 Americans in 2015 died from heart disease, and over 300,000 died from coronary artery disease. And while the trend in general was downward for several years to the point where we were approaching cancer, the 2 most predominant dietary strategies that have been shown to be beneficial are the Mediterranean diet, which is more focused on obviously the same kind of fruits and vegetables, nuts, legumes, but also fish as a primary meat, animal source of protein, olive oil for cooking purposes, red wine, things like that. And then a more of a plant-based, whole food plant-based dietary strategy. As a vegetarian, for instance, you primarily are just avoiding meat-containing products, so animal-based meat products. As a vegan, on the other extreme, you're talking more about avoiding anything that comes from an animal source, so milk, cheese, as well as animal-based meats and things like that. Certainly a plant-focused diet is one where the vast majority of your calories are going to come from plants and legumes and nuts and things like that. And you would avoid animal-containing products when possible, but certainly it wouldn't be as rigorous or as dogmatic as a true vegan lifestyle. Some of the specific benefits to transitioning to a plant-based diet are certainly weight loss. Because the vegetables and fruits that are involved in that kind of dietary strategy have so few calories but take up so much space in your stomach, it's really quite easy to eat almost anything you really want without having to pay too much attention to counting calories and things like that, and still have weight loss as well as feel full. In addition, all the nutrients and protein and vitamins and things that are needed for your diet are found in plant-based sources. People talk about, when they go to family gatherings and there's no vegetarian options, they go out to eat and it's all meat-containing options. When you're busy and you work a lot and you're on the go and I don't have time to chop up vegetables for 45 minutes and things like that. I think these are all real concerns. The good news, from my perspective is, as I made my transition from being more of an omnivore, probably more honestly a carnivore, to a whole food plant-based dietary strategy is that the grocery stores have gotten more hip to this kind of transition. I think that there's a lot more options out there for people that want to avoid animal protein sources. I've been pleasantly surprised actually that there's a lot more patients out there that are receptive to this kind of an intervention and want to know more about it. And so if you talk to people that have been able to make this transition successfully, they would tell you they feel better, they're sharper mentally, they've lost weight, they've either cut down or eliminated the medicines that they take. They're able to exercise more, feel stronger, their relationships are better. This is what you have to gain by making this change. And for me personally, I would never have known the taste profiles that were available out there with a plant-based diet if I'd never made this transition. Meat-containing products, steak, chicken, very predictable, very dependable. You know what you're going to get. You may be able to change what you put on top of it, but the taste is predictable. And I just never would have looked past the meat section when it came to eating at a restaurant or things like that, and had all these amazing foods I've had the opportunity to try at this point in time that I now get to enjoy on a daily basis. And I think I owe that to the fact that I took the plunge and decided to do this for myself. And so hopefully that'll be the experience for people that try this.
All right, so that's a great video just highlighting some of the benefits and how much easier it has gotten in the last couple of years. So our question next is, when we think about whole foods eating, one of the common objections that I get as a health coach is that eating more fruits and vegetables
webinar. My name is Luke
is
Corey, and I'm a
more
registered
expensive
dietitian.
than a standard American diet. Oops. There we go. So in fact, eating more whole foods and plant-based is not more expensive. With the cost of inflation going up, you probably have witnessed this at the grocery store, that your grocery budget isn't going as far as it once did. So incorporating more plant-based whole foods can offset the increased price and keep your family full and healthy, and providing them a nutritious meal. So Kelly, you can go to the next slide, which shows some of the cost savings benefits. The most expensive parts of our food budget are poultry, meat, and seafood. So the USDA, they currently predict that cattle prices are going to increase about 7.5 to 10.5%, and poultry prices are going to increase about 4 to 7%. And YouGov did a survey that concluded that about 32% of Americans are planning on transitioning to more plant-based eating this year as a result of those increased prices. So while it's a common belief that eating more plant-based is more expensive, that isn't necessarily true. Simply by replacing those snack items at processed food with more whole foods, you can save yourself money. So I looked on my Walmart app here. I'm in Fond du Lac, and I looked at what the cost of a bag of oranges is compared to a bag of Doritos. In my house, a bag of Doritos lasts about 2 days. A bag of oranges is going to last probably a week or more. So the 3-pound bag of oranges was $4.73, and that the Doritos were $4.48. So even though the oranges were a little bit more expensive, they're going to last a lot longer. And obviously they're much higher in fiber, they're lower in calories, they're better for me and my family. So maybe as you look at your food budget, you can identify some of those things as well. And next, the other financial component is when you consider the cost of medications. We are going to pay for our health in one way or another. We're going to pay for it in convenience by getting convenient fast food, which will probably affect our health down the line. And we might end up paying for our health in those medications later on. So we'll talk about that in a little bit. But next is the environmental impacts. So this would be another reason why some people choose to go more plant-based, is to reduce their footprint because of the amount of water and fuel that it costs to raise animals. So for example, a pound of beef can take about 1,800 to 4,000 gallons of water to produce. And according to the Water Footprint Network, the average water footprint per gram of protein in beef is 6 times that of legumes. So we kind of take for granted having clean water available to us. But it is impacting our environment. On top of that, there's also the fertilizers, pesticides, and fuel costs to manage the crops and the livestock that's contaminating the Earth's precious water supply, and the impact on marine life that's having. So if you wanted to look at your footprint and your lifestyle, I would check out that footprintcalculator.org and look into that a little bit more. The other thing that you might be interested in is the Netflix documentary series called Seaspiracy. It really goes into detail on how the commercial fishing industry is polluting the oceans and destroying marine life at a really astonishing rate. When we think about water pollution, a lot of times we just think about reducing our plastics, which certainly is very important, but the bycatch from commercial fishing is leaving nets and wires and all of that in the oceans that are killing our marine life at a very fast rate. So next, we will look at how a plant-based diet can help us manage our weight. So if anybody is like me, maybe you like to eat too. I certainly would be like, oh, all that food on the right-hand side looks wonderful. So eating a plant-based diet allows you to eat a lot more food throughout the day and still stay within your calorie range. Because those foods that you're consuming, they're about 2/3 calories less than other proteins and starches that are on that left-hand side of the picture. Plant-centered diets, they're associated with significantly lower rates of type 2 diabetes because they are lower in saturated fat. That saturated fat is associated with higher cholesterol and insulin resistance, and the high fiber content in the fruits and vegetables helps to regulate blood sugar and reduce the risk of obesity and all the other comorbidities that go along with obesity. So when you look at those two pictures, comparing the one on the left and the one on the right, the one on the left, you may be able to eat that in one sitting. And I know there's times where I just feel like I could eat a lot of food, and that might be a Sunday dinner or something. So that's 1,500 calories. When you look at the picture on the right-hand side, it would be very difficult to eat all of that food in one day, but you can see, or in one sitting, I'm sorry, how much more you can eat for the same amount of calories by following more of a plant predominant way of eating. So at this point, you might be thinking, how do I get started? I'm interested in eating more plant-based, but where do I go from here? I'll share with you some of my recommendations. So you might be familiar with the MyPlate, which is here on the screen. And you can still use this. You're still going to fill half your plate with fruits and vegetables. Your protein could come from a plant-based source, and then you're including those whole grains. And then it's up to you if you wanted to include that dairy or maybe just replace it with water. So my first suggestion is to start with your why. Remind yourself why you want to switch to more whole foods, plant-based eating. Is your goal because you want to have better eating habits? You want to include more fruits and vegetables? Maybe you are looking for weight loss, you want to save some money, you have a love for animals, or you just want to protect the planet. Whatever it is, write that reason down and put it on your refrigerator or put it on a note on your pantry. So on those days where convenience is maybe tempting you or you're losing sight of why this is important to you, it's there to remind you. And second, stock your pantry. You need to have essentials on hand like beans and legumes, fruits and vegetables in order to follow this way of eating. So have your pantry stocked and create shopping lists that allow you to create whole foods, plant-based meals. And then start small. So depending upon what you are currently eating, transitioning to a whole foods, plant-based plant-based or plant predominant diet could be a major adjustment for you and for your taste buds. So don't underestimate the power of small changes. A small change could be that maybe we have a silver alert here. So by starting small, by just eating simply less meat, maybe instead of using a pound of ground beef or ground turkey, you use a half a pound of ground beef or ground turkey on your taco night, and then you use a can of beans to replace that. Or maybe it's one meal. So maybe you aim to have your breakfast or your lunch totally plant-based. Those might be some simple ways, or just having a meatless Monday on your menu. If it's very overwhelming to think about going completely plant-based, think about how you could do that in a small, meaningful way. And then including lots of fruits and vegetables. So of course, that's going to be a big part of what you're eating. So try different ways of consuming them. Maybe it's roasting vegetables, or some people love frozen grapes as a sweet treat. So just look into different ways on how you can eat more fruits and vegetables than what you might be used to. And then changing the way that you think about meat. So here in the United States, and especially Wisconsin, we love our meat, and it's kind of the main course on our plate. And so by changing the way we think about meat, maybe it's just kind of the garnish on our salad, or we're trying to fill our plate with lots of colors, that our meal isn't completely centered around meat. And then cooking one vegetarian meal per night. I kind of mentioned that with Meatless Mondays, but you might want to try something like a pasta with marinara sauce, black beans and rice, a lentil soup or salad, bean burritos, sweet potato quesadillas, bean chili. You could replace burgers with portobello mushrooms, doing kebabs with different vegetables on the grill, making a lentil soup or split pea soup. And trying different ethnic dishes is a great way. Different Asian curries or Brazilian feijoada or Thai peanut dishes are also some great options to look into. And then if you do have a favorite dish like lasagna, maybe look into doing like a eggplant lasagna. Take that favorite dish and try to swap out some of the animal products in it and replace those with vegetables. So next we're going to hear from Christy Fast. Christy is our QHI program coordinator here at Network Health, and she has been eating this way for quite some time. And I'm so excited for her to share her experience with you. So Christy, a couple questions. What motivated you to start eating a whole foods, plant-based diet?
Thank you, Chrissy. So I was a runner throughout high school and college, and I still run today. So I've always tried to lead a healthy lifestyle. And so running and strength training have been important to me, but I also learned that I needed to properly fuel my body. So this led me to study health promotion in college, a degree that encompasses my love of fitness and healthy eating. But then years later in 2016, when my son turned 6 months old, he was starting to eat solid food. And I just wanted to put the best foods in his body. And I had heard about this plant-based whole foods way of eating from my parents, actually, who had started a few years before that. And I had seen the benefits from them switching to a plant-based lifestyle. So I started to do my own research. And I was resistant because, we all need to eat meat for protein, and milk does a body good. But after I learned a little bit, we don't need to eat it or consume it. And we are able to cut down on the animal products and we can stay healthy.
That's awesome. Thanks for sharing that. So can you share a little bit more about how you made that transition to more plant-based whole foods?
Yeah, so in my research, I found a lot of websites and other plant-based people and doctors online. So this helped me to find my resources like Facebook support groups. I looked at a lot of different cookbooks out there, and I started to make small switches like you mentioned before. So I started to change out almond or cashew milk or soy milk for my dairy. I slowly cut out cheese, maybe use a little less on my meals. And then I would add more vegetables on my plate and incorporated more beans and potatoes. And then when I would go out to restaurants, which I go out to restaurants almost every weekend, I'm always looking for a plant-based or a vegan option at the restaurants.
I love that you shared that you can still go out to eat and enjoy things with your family without feeling like the odd duck out, that you can find things that are available and still feel full. So great. So once you started making this transition to more whole foods, eating plant predominant, what benefits did you notice?
Some of the benefits I noticed were that my cholesterol levels dropped. My digestion improved, and I don't feel so sluggish after my meals. So I get enough protein and I stay at a consistent, healthy weight. And once a year, I go to my doctor, and she knows that I am on this way of eating. And so I always get my cholesterol and glucose levels checked. And she also monitors my iron levels as well. And those have been just fine.
Yeah, that's amazing that you saw improvements in your cholesterol being a runner, and it would probably be a stereotype or assumption to assume that you had really good cholesterol
Right.
and glucose, but you even saw improvements from switching. Awesome. So can you tell us what a typical day of eating looks like for you?
Yes, you did touch on a few staples I have in my meal plan, but for breakfast, I really like to eat oatmeal. And so I will make oatmeal with either plant-based milk or water. And then I add maple syrup, cinnamon, even flaxseed, chia seed, hemp seeds, walnuts. And then I really like to add a cacao powder, like a chocolate powder and peanut butter. And really, you can do whatever mixtures you would like to in your oatmeal. And this makes you satisfied for a long time in the morning. For lunch and dinner, for lunches, I usually have leftovers from my dinner during the week. So for my dinners, I can make like a lentil lasagna soup, a chili, pasta, mac and cheese with the cheese I make from potatoes and carrots. I like to do sweet potato and black bean quesadillas. You can add salsa and avocados there. I can make a veggie pizza with no cheese and add all the vegetables I want. I make a meatless burrito bowl. I can put that in a taco shell or just add some avocados to it, eat it with chips. Burrito bowls are popular right now, so different grains and vegetables in a bowl. I have tacos with beans and rice and vegetables. Salads are important as well. And then I like to roast vegetables and potatoes and sweet potatoes too. And just some snacks that get me through the day are maybe fruit like grapes, apples, bananas. And then I like to have some pretzels and peanuts, vegetables with hummus. And then for my drinks, I just usually have black coffee in the morning and water, but you could also add some fruit to make a, more flavored water.
That all sounds so good. My mouth's watering.
Yeah, so many options.
So many options. Kelly, if you could go to the next slide, we have some more questions. So how do you stay inspired with some of your meals and meal ideas and recipes?
Like I mentioned before, with the social media groups I found or the websites, there's just so many resources out there now. There's a lot of different videos. A lot of people are making YouTube videos you can watch on how to make these meals. A lot of documentaries out there to get you motivated to make some switches. Some great resources are like Forks Over Knives. Some documentaries you could check out are What the Health. Forks Over Knives also has a movie, and then The Game Changers, which is about athletes and their benefits from eating plant-based as well. And then I also like to go to my local library, and they actually have a ton of books out there and cookbooks even that you can check out. So you don't have to purchase them yourself. You can just go there and see if you like it. If you do want to buy it after you check it out, that would be great. But yeah, they have lots of resources as well.
Do you have a favorite cookbook that you like to use?
Let's see. I have so many at home that
I know
I
I'm
don't
putting
have.
you on the spot.
Yeah.
I thought you
There's
had one that was like fancy plants or something, and it had a fun name.
Yes. Oh, it was Party in Your Plants.
Party in Your Plants. That's it.
That's a good one.
What advice would you give to somebody who is wanting to transition to eating this way, eating more plant predominant?
You had a lot of good suggestions already. So to add on top of that, eating a lot of vegetables. So like you said, filling half your plate with vegetables at lunch and dinner. Try adding different colors to your plate, really getting that rainbow of foods. And then also cook a plant-based meal at least one night a week. Try starting small, like you mentioned. And then include whole grains for your breakfast. So you can start with that oatmeal or a plant-based pancake. I can make one with, you could use some flour and bananas. There's some different recipes out there using that. And you can always add toppings like fresh fruits. You can make plant-based like banana bread or muffins, pumpkin muffins, spinach muffins, things like that. And then also build a meal around a salad. So using your salad greens, romaine or spinach leaves, and then adding all the vegetables you can, even beans or peas to it. And then maybe an idea for dessert, having fruit for dessert. So watermelon, banana. You can even make a little chocolate sauce using like maple syrup and the cacao powder that I was talking to. Lots of different options out there. Even you can make, like they call it, nice cream. So using bananas or different fruit to blend that up in your high-speed blender to make a little ice cream treat for yourself.
Those are wonderful ideas. Thank you so much for sharing your experience with us and what you do. It's been really helpful. Thank you. Well, I have a quote for you. This is from Michael Pollan. He wrote a book called Food Rules, which is really simple. You could check that one out from your local library as you're looking for some plant-based books. You could probably read the whole thing in one sitting because it's not very many pages, and he has simple things like this on there. He says, eat food, not too much, mostly plants. That more or less is the short answer to the supposedly incredibly complicated and confusing question of what we humans should eat in order to be maximally healthy. So I think that is just simple and to the point. So if you are wondering what, as a Network Health member, you can do to get more support, we have a couple options for you. We have our Prevent T2, Prevent Type 2 Diabetes Prevention class, or our Healthy Living with Diabetes class. If those are of interest to you, please contact us at that email listed there. Or if you're interested in working with myself or one of our other health coaches, you can email our health coaching inbox, and we would be happy to set up an appointment with you. Both health coaching and the Prevent T2 and Healthy Living with Diabetes class, they're free for our members. If you are a Medicare member, you likely have Silver Sneakers available to you. And some of our commercial and individual and family plans also have access to Wellbeats, which is like a virtual online gym with tons of classes. They have different recipes on there. Some of them are plant-based, and you would find that very valuable, I think. So with that, thank you so much. And kind of turn it back over to you, Kelly. Thanks.
Yes, thank you, Chrissy, Christy, thank you so much. I have a whole notepad here full of notes and new recipes. And my mouth is also watering, Christy, from everything that you shared. So ladies, thank you again for joining us and for sharing all of this really helpful information. I know our viewers will definitely learn so much from our time together today. So like Christy had mentioned, if you have any questions or would like additional information, there are lots of ways to get in touch with us. I also wanted to share my contact information. Again, if you have questions or would like some additional resources or information, we're happy to help you. Just want to thank you all again for joining us today. We hope that you take care and that we hope to see you again soon. Thanks so much, everybody. Bye-bye.
Bye.